Assalamualaikum dear students, welcome to your channel The Anatomy Canvas. In today's class of Embryology Foundation module lecture 15, we are going to discuss with the fetal period. So development of the fetus in the fetal period, the period from beginning of 9th week to birth is known as fetal period, and it is characterized by maturation of the tissues and organs and rapid growth of the body. Length of the fetus is usually indicated as crown rump length, that is sitting height, or as the crown heel length. So there are monthly changes in the fetal period. The growth in length is particularly striking during 3rd, 4th and 5th month, while an increase in weight is most striking during the last 2 months of the gestation. One of the most striking changes taking place during fetal life is the relative slowdown in growth of the head compared with the rest of the body. So please remember, first the growth in length occurs usually in first trimester, in the first half of pregnancy, while growth in weight, increase in weight occurs in the second half of the pregnancy, especially in the last 2 months. So this is the first month repetition from the previous lectures. The cell multiplication begins in first month. The fertilized egg attaches itself to the lining of the uterus. You can see over here the implantation take place. Internal organs, the circulatory organs and nervous systems are beginning to form. Small limb buds show beginning of arms. Yolk sac provides nutrients and blood to the fetus until the placenta is formed. So in this diagram you can say this is the amniotic cavity and this smaller one is the yolk sac. Here you can see the fetus which is present and developing placenta which is present over here. In this diagram you can see in the uterine cavity the fetus has started implantation and it has started to develop in first month of life. So this is the diagram in which you can see, first look at this. This is the developing area of the central nervous system, that is brain. Here you can see the primordium of the eye which is present. Also you can appreciate the brachial or pharyngeal arches, the bulges formed by the heart, the bulge formed by the liver. This is the umbilical cord. Here you can see the tail fold is present, and this one is the leg bud, and here you can see the arm bud. Here you can see the somites which are present. So this is the first month of the pregnancy in which you can appreciate different changes in the baby. In second month of pregnancy, the embryo is about 1 inch long. The facial features begins to take shapes, it more looking like human. Bones begin to form and internal organs begin to develop. Crown rump length is taken as a criteria to measure the age of the fetus. So you must know the crown is the highest point, it is the vertex which is the highest point of head, and the rump is the midpoint between the two buttocks. So at this stage, before this stage, we are counting the age we are estimating the age of the fetus by counting the number of the somites which are present. But in second month it is usually difficult because the fetus has grown and it is difficult to count the number of the somite. So at this stage we are estimating the age of the fetus by measuring the crown rump length, which is also called sitting length of the fetus. This fetus is floating in an amniotic cavity, and this amniotic cavity giving it a cushion and protect this baby. Here you can see the umbilical cord, and here you can see the placenta which is developing. So size of the baby is basically 1 inch long at this stage. The placenta is an organ with the blood vessels that nourish the baby in the uterus. So you can see this is the placenta. This is the fetus in the second month. Here you can see the eyes are developing, the central nervous system, especially the brain. It is almost half the total length of the crown rump length in second month of the pregnancy. Here you can see the umbilical cord which is present, the upper limb buds and lower limb buds, and they are developing in this process as well. Here you can see this is the amniotic sac in which amniotic fluid is present, and this baby is floating in amniotic fluid which protect it and which provides as a cushion. And here you can see the developing placenta. Through umbilical cord, baby is connected to placenta which act as an organ of nutrition as well as an organ of excretion at this stage also. So in third month, what are the different changes which are occurring in third month? The baby is nearly 2.5 to 3 inch long and is almost fully formed because all of the major organ systems, their primordia has been developed. Baby has begun swallowing and kicking movements. Although the size of the baby is very small, so the mother cannot appreciate the kicking movement at this stage, but baby starts kicking at this stage. The all organs and muscles have formed and are beginning to function, and the umbilical cord is the cord that connects the baby to the placenta, so it is beginning of your navel. Also remember that at 6th week of the pregnancy, the umbilical cavity is small to accommodate all the loops of the intestine. So these intestinal loop bulge and herniate through umbilical ring into the yolk sac, which is called the physiological herniation. But at 12 week of the gestation, near at the end of the third month, at this stage, these physiological loops are drawn back into the umbilical cavity. So these both at the 6th week when physiological herniation occur, and at 12 week when these herniated loops are drawn back into the umbilical cavity. These both are MCQs as well. Also you remember at this stage the baby is more looking like a human. The ears are low set at their proper place. Eyes are more medially present. The limb buds, you can see they have developed, they are grown. The primary ossification centers of all the long bones have started. In this fetus, you can see the position of the ear. It is nearly at the adults, as you can see in adults. Also, the eyes are more medially placed. At this stage, first a constriction occur proximal at the distal part, and then another rays occur, the four rays which divides this flattened part of the limb, and these digital rays then divide and they form primordia of the finger. Also, another constriction later occur at this stage, and in this way a proper upper and lower limbs are formed in the embryo. So important feature you must remember in third month are that the face is more human looking, eyes and ear are at their proper position, the limbs have reached their appropriate length, primary ossification centers of the long bones have appeared, external genitalia have developed. Physiological herniation which usually occur at 6 week, now at the 12 week these herniated loops are withdrawn into the abdominal cavity. At this stage head circumference is nearly 1/3 of the crown rump length of the baby. And also important is the reflex activity has also been started at this stage. So these are the different features. This is the first trimester. Third month has completed and all the primordia of all the major system have developed, and now we move on to the fourth month. So in fourth month, baby is covered with a layer of the thick downy hair called lanugo hairs. This baby, when you will see in the scan, even ultrasound, you can see this baby is covered with the thick hairs. These are the lanugo hair. Baby's heartbeat can be heard clearly at this stage. This is also very important. At this time, it is the time when a mother feels kicking movement, which is also called quickening. And this is a very important sign because now mother appreciates that his baby is alive. This quickening is usually difficult to appreciate by primigravida because this is the first pregnancy and they cannot appreciate usually in fourth month of the pregnancy. But in cases of multigravida, they feel the quickening movement even in fourth month as well. Genitalia, as I have told you, they are also developed. Here you can see the umbilical cord and connection to the placenta. So in this diagram, this is the diagram of the fetus. You can see the eyebrows, the eyelids have started to develop. Here you can see the earbud, the limbs have properly arrived, it reached their proper appropriate length. Here you can see the umbilical cord, the lower limb bud, the upper limb bud. Upper limb bud usually appears at the cervical C4 to T1 level, which is the region of the origin of the brachial plexus. In the fifth month of the pregnancy, the protective coating called vernix caseosa begins to develop on the baby's skin. So a thick sebaceous material is present which covers the baby's skin, and this sebaceous material is the product of secretion of the sebaceous glands of the baby, which is called vernix caseosa. And by end of this month, baby will be nearly 8 inches long and weigh almost a pound or less than 500 grams is the weight of the baby. Most of the length it has acquired, but the weight of the baby is very small at this stage. Also very important, even at the ultrasonography we can appreciate the sex of the age as well at this stage. In 6 months of the pregnancy, the eyebrows and eyelids are visible. You can see over here. The baby's lungs are filled with amniotic cavity. You can see baby is floating in amniotic cavity and is swallowing the amniotic fluid, which enters through esophagus and then into the trachea, into the lung. And this amniotic fluid is very important for conditioning of the lungs. So in this at this stage, the baby's lungs are filled with the amniotic fluid. And another important point is at this stage baby can hear. So if you talk or sing, he can hear itself, he can hear you. This is very important also. You can see this is the vernix caseosa. This is the white sebaceous material which is covering the baby's skin at this stage, and it is product of secretion of the sebaceous gland. Also you can see very fine hair which are present over here. These are the lanugo hair. You can also appreciate the development of the nails as well at this stage. Eyebrows and eyelashes are also developing. Although major organ system have developed at this stage in 6 months of the development, but the coordination between the central nervous system and the fetal respiratory is not yet developed. So if baby is born at this stage in 6 months of pregnancy, it is very difficult to survive because there is a poor coordination between central nervous system and the respiratory system as well. In 7 months of the pregnancy, by end of this month, baby weigh about 3.5 pounds and is about 12 inch or 25 centimeter long. Baby's age is estimated by the crown heel length, which is also called standing height. From the crown is the highest point of the vertex till the heels, and this is the length which is where also we can appreciate femur length at this stage. This is another criteria by which we can estimate the age of the fetus, and another criteria is the biparietal diameter at this stage as well. So by measuring biparietal diameter we can also estimate the age of the baby at this stage. Baby's body is well formed, fingernails cover his fingertips. Another important point is if baby is born at this stage, its life expectancy is very good. Although it is difficult and baby may have a respiratory distress syndrome because at this stage usually surfactant is not properly produced and there will be increased surface tension at this stage in the alveoli, which can lead to respiratory distress syndrome. But with the help of modern technologies and incubator etc., this is possible that the baby will survive at this stage easily. So you can see here, these are the blood vessels present in the umbilical cord, and this is the chorionic sac, and baby is floating in the umbilical in amniotic cavity. And here you can see the limbs and abdomen and thorax of the baby. So in 8 months, as the age advances, the life expectancy and survival rate also increases very much. So baby is gaining about half a pound per week weight, and layers of the fat are piling on it. Subcutaneous fat is basically produced, and this is very important because if baby is born before this time, their subcutaneous fat is not properly formed, and there will be chances of hypothermia as well. Baby cannot maintain its body temperature, which can lead to hypothermia and death of the baby. So in 8th month of the pregnancy, subcutaneous fat has been developed, and this can lead to it can help to maintain the body's temperature. Baby has probably turned head down in preparation for birth. So this is usually normal position. Head down position is normal. This is called occipital position, and this is normal position, and baby is now preparing for the birth. Baby's weight is nearly 4 to 6 pounds at this stage. So here you can also see the head of the baby, is his limb, his genitalia, the scrotum and the penile area are visible. Also you can appreciate the umbilical cord, and this one is the placenta. In 9 months of the pregnancy, the baby has 6 to 9 pounds weight and measures between 19 to 22 inches. As he becomes more crowded, you may feel him move around less because it has grown now, and its weight is now 6 to 9 pounds, and there is a less space in abdominal cavity. So mother may appreciate that the baby has reduced movement. This is normal at this stage. So these are the monthly changes. At age 9 to 12 week, baby's length is crown rump length is 5 to 8 centimeter and weighs is 10 to 45 gram. At 13 to 16 week of pregnancy, baby's crown rump length is 9 to 14 centimeter and weight is 60 to 200. 17 to 20 week, it is 15 to 19 centimeter and weight is 20 to 50 to 450 grams. So these are all which are given in your book as well. At the end of the pregnancy, at 37 to 38 week, baby's crown rump length is 35 to 36 centimeter and weighs about 3000 to 3400 grams. So developmental horizon during fetal life are that with the events which are taking place. So taste bud appear at 7 weeks, and babies start swallowing movement at 10 weeks. After that, baby can swallow the amniotic fluid, which enters into the lungs for conditioning of the lung, and also into the esophagus, into the gastrointestinal tract, where the fluid is absorbed through GIT and entered into the fetal blood and excreted again by the kidneys. The respiratory movements usually takes place at 4 to 16 week of pregnancy. Sucking movements usually takes place 24 weeks. Some sounds can be heard at 24 to 26 weeks, and eyes are sensitive to touch. Eyes are sensitive to light at 28 week of pregnancy. So these were the developmental horizon during fetal life, and here I complete my today's class. The reference is Langman's Medical Embryology. Thank you very much for your attention for the today's class, and inshallah we will meet in next class. Allah Hafiz.